Nigeria has placed its capital Abuja and six other states on high alert following its emergence of the Delta variant of the coronavirus infection in the country. The Presidential Steering Committee on COVID-19 in a statement on Saturday said that the number of new cases and hospital admissions have continued to rise. Now, the two most populous states in the country, Kano State and Lagos State, are amongst the six places with worrisome early signs of the third wave of the pandemic. The Nigerian Center for Disease Control said 203 new COVID-19 infections were recorded on Sunday. So far, nearly 170,000 cases have been confirmed, with 2,127 deaths.
With growing public apprehension about the spread of the Delta variant of the COVID-19 virus, Nigeria's Ministry of Health has placed a red alert on 6 states in the country. But health experts are calling the measure inadequate, with some of them proposing a comprehensive imposition of the red alert on the 36 states of the Federation. For more on this, we're now being joined by Professor Oyewale Tomori, a Nigerian professor of virology, educational administrator, and former vice chancellor of Redeemers University. Good to have you, as always, with us on the program, Professor.
It's my pleasure to be with you.
Okay, hopefully you can shed some light on some of these concerns that are brewing. It's Salah season, and the Presidential Steering Committee has laid out its plans in a press statement as to how it's going to place 6 states on red alerts, including Lagos State. What are your thoughts about this? Do you feel this would be an adequate measure, given that we're now on the verge, or if not in, a third wave?
Thank you very much. I think it's inadequate. Placing the red alert on 6 states is not the solution. It is placing extra red alerts on every state of the country, because this is a virus that knows no boundary. It doesn't require visa. And the way we move around, I mean, just over the weekend, you remember all sorts of large gatherings that are taking place in different parts of the country. People are moving from one end to another and returning to the places. So placing an alert on 6 states is a weak measure. Every state should be on the alert. And let me put it that way. You remember the so-called Delta virus, although it's just been discovered in Nigeria, but the mother of the Delta virus has been in this country since April. And we knew about that. You know, the time when the government placed embargo on flights from India, as far back as that time, we knew that 6117 was in the country. So why didn't we take action at that time? I mean, much more serious action. Because of the puny action we took at that time, now we're getting ready for a bigger one that is coming. It's a massive action that should be taken. Every state of the country should be on red alert.
And Professor Tomori, you mentioned massive action should be taken. To what extent? Because when people are listening to this, are we supposed to probably go back to enforcement of wearing a face mask properly, or probably even lockdown? To what extent should we go to ensure we curb this?
No, I don't. I think 2 things. I mean, the issue of wearing masks must remain. I mean, whether we like it or not, we have not passed through. We must continue to wear masks. Even those of us who are vaccinated must continue to wear masks. That's number one. Gathering of large number of people is the major problem of spreading this problem. The more people, the large people. We've seen a few things over the weekend where people are not bothering to wear masks. People are still going to churches. They're going to all those places. Time has come for us to limit all those things, enforce those spacing things in the different parts. You know, every part where it is coming. And that's the first thing to do. Again, our people must get out of this feeling that there's no, COVID is gone. Anywhere you go in this country, in the streets, in the market, they're looking at those of us wearing masks as if we're stupid. We are not. We are protecting our life. They too should protect their life. Every Nigerian should put on their mask, wash their hands. Let us avoid all those large gatherings. And I've seen churches, mosques, whatever. They must avoid them. Otherwise, we're going to have a much more bigger wave than we had in the second wave.
Okay, Professor Tomori, I just want to go back to something you said, which I'm still digesting. You said the mother of all of the Delta variant has been in this country for a while now. What of those who are listening to you and thinking incredulously, why are we not seeing the impact of these viruses? We saw what happened in India. Why are we not seeing the death toll rising in Nigeria? And so as a result of not seeing, as they say, seeing is believing, people are going about their normal lives. What do you say to such people?
You see, the problem, the situation with us, I think that's the problem we're saying. We keep comparing ourselves to India. We keep comparing ourselves to England. We have different age structures in those different places. Go and check. All those who are dying either in India or in Europe are the elderly people who have other comorbidities. When you look at the population pyramid of Nigeria, it is very, very broad at the base. In the other parts of the world, it is very broad at the top. And those are the people who are dying. So the fact that people are not dying does not mean people are not getting sick. If we are looking at this number of deaths, then of course, then we say, yeah, we're not seeing them. But people are getting infected in this country. And because we're not testing those people who are getting infected, who are asymptomatic, we think our numbers are going. Suddenly, there was 2-3 weeks ago, we are getting numbers like 0 case, 1 case or something. Yesterday, you got 260 something. Wait for it. It's coming. So all those who think that there's nothing, they better get themselves ready. Something is brewing in this country over this COVID problem.
All right, I want to say many thanks to you, Professor Tomori, for catching up with you once again. He's a professor of virology.